For folks who have joined us, I'm Garrett Martin. I'm the president and CEO of the Maine Center for Economic Policy. I use he, him pronouns. And today, I think, as you know, we are here to talk about the Big Ugly Bill. HR 1 is its formal title, or the One Big Beautiful Bill Act is what it was initially titled in Congress. Our focus today is really talking about the impacts of this tax and bill on Maine people and Maine communities. And I'm delighted to be joined by two great partners in this conversation, Alex Carter, who's a policy advocate with Maine Equal Justice, and Francis Eanes, who's the executive director of the Maine Labor Climate Council. They'll both have lots of great information to share as we get into it. And of course, we hope you'll stay engaged with us with questions and feedback throughout the event. We'll be here for about 45 minutes, 50 minutes, depending on the level of questions and energy. But if you haven't had a chance, again, please feel free to add your information in the chat. Tell us where you're from and any questions you have, and we'll just keep things rolling as best we can. So for those of you who are new to the Maine Center for Economic Policy, thank you for joining us. We're glad you found us today in this webinar. Our goal at the Maine Center for Economic Policy is to make sure everybody has a fair shot at a good life. And we do that in a number of ways. We provide research and analysis on economic issues. We work with policymakers to build solutions that result in better outcomes for Maine people. And we're generally a resource for advocates and allies around the state who are interested in making the Maine the best version of itself it can be. We also want to acknowledge that the land and we are sharing and extending beyond Maine's borders is occupied by Wabanaki homeland. We recognize the inherent sovereignty of the Maliseet, Mi'kmaq, Passamaquoddy, and Penobscot nations, and work to build durable relationships with those communities that respect tribal authority, culture, and traditions, and advance the cause of economic justice. And to that end, we actually have a report coming up soon about this issue of tribal sovereignty and what it could mean for Maine and the history of how we got to where we are now. So keep an eye out for that. But in the meantime, again, please drop your questions along the way that you may have in the chat, and we'll get rolling. So as I said earlier, we're really here today to talk about the big, not so beautiful bill. Lots of people have named it different things. There's the billionaire giveaway and healthcare cut. There's the big bait and switch bill. We tend to call it the big ugly bill. What we really want to do for you today is provide some information, again, that is helping to connect the dots for what this major piece, the signature piece of legislation, quite frankly, for the Trump administration means for Maine people and Maine's economy. And hopefully in providing that information, we can help ensure that we are going into this next phase of our state legislature with eyes wide open about what this could mean for our state and our communities and what we can do about it. So we'll focus primarily on the tax changes, some impacts on healthcare and food assistance, and then on our clean energy economy. So that's where we are. If you found the right place, great. Buckle up. And again, keep chiming in with your questions as you have them, and let's let her rip. So the basic framework for this proposal, I think that people should really put deep in their minds, is that this bill represents the largest transfer of wealth in our nation's history. It also represents the largest cut to healthcare in our nation's history. So from that standpoint alone, there are a number of things that we are deeply concerned about as it relates to Maine and Maine people. So when we talk about the tax provisions, which is where Maine Center for Economic Policy spends quite a bit of time and is one reason why I'll speak to these today, I think it's important to recognize that, first of all, the tax cuts are just a continuation in many respects of cuts that were already in place from 2017. So what that means is that most people are not going to see any significant change in income as a consequence of this bill. They will merely continue to benefit from the provisions that were in place before. But that said, there are some new things that have been layered in that provide more benefit to the top and do very little for lower and middle income households. But at its core, this bill is fundamentally a lopsided tax cut that benefits the ultra rich at the expense of everybody else. Now in Maine, because we have relatively lower levels of income, the top 1% get roughly $34,000 a year in benefits, while the bottom 20% of households earn roughly $30 a year in benefits. But those giveaways to the wealthy are made permanent, and the crumbs that everyone else receives will quickly be consumed by the other provisions of this bill and ultimately mean that those people are worse off than they were without this proposal. So it's important to note that as we think about this bill, it provides significant resources at the top while providing very limited resources to everyone else, and ultimately taking any of the gains away from those people through other provisions that undercut their ability to have access to healthcare, food, and other supports in their communities. Another key provision of this bill is it does make some changes to the child tax credit, but those changes, again, are a great example of how this bill gives preferential treatment to wealthier households and does very little for low and moderate income households. So the increases to the child tax credit that were made that help families, and we know that this is a very important policy to get right, because during the COVID period, we actually saw child poverty in this country get cut in half because of changes to the child tax credit that have now gone away. And as a consequence, we're seeing in the latest data that child poverty is back on the rise in a significant way. But the provisions in this bill, not only are they not available to low income households who had limited tax liability, but it strips away the benefits for millions of US citizen children who live with parents who are immigrants. And that is just one way in which we see the balance of the economy skewed again towards upper income households over lower and middle income households. So while the benefits of this are already basically in place, the cost and where the cuts are being made are new. These are things that are being taken away newly, and so people are going to be harmed. And that's what we want to get into a little bit more here in just a second, in particular talking about the healthcare cuts and the cuts to food assistance. But the last provision I want to speak to in terms of the tax changes is there are a number of changes that are put in place that are temporary and sound good on paper for working people. So for instance, exempting tips and overtime income from additional taxation. Those are temporary. The expanded standard deduction for older Mainers and older people, those are similarly temporary. But what's made permanent are tax breaks for big corporations and the wealthy that allows them to avoid paying taxes while the shareholders pocket more profits. So it gives our economy a bit of a sugar high, which we're seeing right now in terms of how the markets have responded, in terms of some of the economic activity and indicators that we've seen. We saw this before in 2017. But when that high goes away, there's going to be a significant level of pain and suffering that will be revealed as those provisions, the cuts, start to come online, which they're beginning to do now, but the big share of them won't come on until 2027 and 2028. So with that, I want to transition to talking about healthcare. So at the same time that the big ugly bill gives $1 trillion in tax cuts to the wealthiest households, it also cuts almost $1 trillion in funding for healthcare. This will make it harder for Maine people to keep their healthcare while ensuring that state taxpayers and hospitals will be stuck with the tab. It also fails to deliver for families that obtain subsidized coverage through the health insurance marketplace. So a number of households that get their coverage through coverme.gov are going to see their costs go up dramatically. At the end of the day, this is a recipe for more uninsured families. It's more red tape, and ultimately it's going to be higher costs for everyone else. And when we think about what this means for Maine, the price tag of these cuts to Medicaid are projected to be over $200 million a year. So that's $200 million a year in federal dollars that are being taken out of the state's economy and being pushed onto the state government to pick up the tab for if we're going to continue to provide those services for our people. Meanwhile, our ability to compensate for the care that people are receiving, because you don't get to choose whether or not you get sick and whether or not you need care, that compensation is at risk. And ultimately, jobs and healthcare facilities, particularly in rural places, are similarly at risk. So I'd like to bring in Alex to talk a little bit more about what some of these cuts look like and what they mean for Maine people. So Alex, if you will, take it away. Thanks.
Thank you, Garrett. And again, I'm Alex Carter, she, her policy advocate at Maine Equal Justice. I'm glad to be with you all today, even to discuss such a hard topic. Just to level set again, this bill represents the largest cuts to healthcare and food assistance in the history of the SNAP and Medicaid programs, targeting the people who can least afford those cuts. So as Garrett noted, there are severe economic implications, as well as cost shifts to the state and our healthcare safety net providers. But I will focus a little bit more on the impacts to individuals and households, as is the focus of Maine Equal Justice, serving people with low income. So one of the mechanisms that they're cutting healthcare assistance for people with low income is to put additional red tape and barriers to enrollment in place. And one way that they're doing that is through work reporting requirements. So for the very first time, we're going to see work reporting requirements for adults in the expansion group in Medicaid. That's people 19 to 64 who are going to be required to report work or volunteer hours in order to keep their healthcare coverage through Medicaid or our MaineCare program here in Maine. Many of these provisions that you'll hear about, I'm going to list a few and happy to answer questions afterward, are also staggered because we know how unpopular taking away healthcare from people is. So this one will actually not go into effect until January 1st of 2027, after the midterm elections. But the Department of Health and Human Services has estimated that over 30,000 people will likely lose their coverage through Medicaid for the inability to comply with those work reporting requirements. And many of those people we know are working. It is extremely burdensome to keep up with that paperwork and to understand many of these changes as they happen in real time. It could be closer to 70,000 people losing their MaineCare if the state is not able to do the necessary data matching between their public benefit programs, for example, SNAP and Medicaid, both of which will now have work requirements for certain adults. Another group of sort of cuts and eligibility restrictions that we're seeing for individuals and families are for immigrants. So unfortunately, come October 1st, 2026, less immigrants with lawful presence. So that includes refugees, asylees, survivors of domestic violence and human trafficking will be eligible for MaineCare as well, for our Medicaid program. And coupled with additional restrictions to access to subsidies on the Affordable Care Act on the marketplace, many of those people will actually just lose all of their pathways to comprehensive healthcare coverage. And that's something that we're really, really concerned about. Something that Garrett also mentioned is this cost shift idea. So there's a cost shift to the state, but there's also going to be cost shift to individuals. So later on, into 2028, there's also going to be a cost sharing requirement added for MaineCare participation for many people. And we know as a legal services provider that works with people with low income, even a few dollars can be a huge challenge for families that are struggling to meet their needs, particularly as costs for housing and food and other basic needs continue to rise. The impacts to our safety net is not just going to be felt by our hospitals, but also by our critical community clinic systems. We know already that our family planning providers are no longer going to be able to bill Medicaid for necessary healthcare services. Abortion is already not allowable to be covered under Medicaid, but Planned Parenthood and Maine Family Planning are the two providers in Maine that are going to be hit very significantly with the inability to bill Medicaid for the services provided. I will say they'd want to be clear that they're still accepting patients regardless of their ability to pay, but of course that is a huge impact on their budget and their ability to serve more people and more regions of our state, particularly in rural areas where more people are utilizing Medicaid at pretty high percentages at our community health centers. And then finally, something that Garrett mentioned that we're focused on right now, and still there is an opportunity for advocacy here, is the expiration of the enhanced premium tax credits for ACA marketplace coverage. So that's when you go onto the marketplace and you purchase a plan based on your income, you can receive a subsidy for your premium based on your level of income. And those during the Biden era had been enhanced and throughout COVID. And those are set to expire at the end of the year. We should be concerned about all of these things, but for anyone with health insurance currently, you should be particularly concerned about this because we've already seen insurance rates projected to be exponentially higher. And without this additional subsidy, many people will be unable to afford health insurance through the marketplace and will just drop out of coverage completely. And that has deep implications for all of us who utilize health insurance and for our providers who rely on those payers. So I just want to name that this is a lot of information, so I'm happy to answer questions, but also these are cumulative impacts. So we're going to move into talking about food assistance, but I just want to keep in mind that many of the same people who rely on Medicaid who will be impacted also rely on the Supplemental Nutrition Assistance Program, or SNAP, or food stamps and other public benefits. So they may see, multiple parts of this bill hitting them at the same time or staggered over a few years, which can be very untenable for low-income households. So back to you, Garrett.
Yeah, so thanks, Alex. Just to put a finer point on the premium tax credits, and you may have some additional information this way, but I know that when we looked into this at Maine Center for Economic Policy, one of the things we saw, for instance, was a 62-year-old couple in Washington County who's getting their coverage through coverme.gov is currently paying about $600 a month. And they're going to see their coverage, their premium rates go up to about $2,400 a month if these subsidies are allowed to expire. So you're talking about an additional $20,000 a year in cost just to preserve their insurance. And from our standpoint, that's not healthcare. That's a second mortgage. So I don't know if you have some similar scenarios you're seeing as you think about this or look into this, but I just think it's important for folks to sort of understand order of magnitude of what this could mean for families. So on the food assistance, I think similar deal as Alex alluded to what we see with the healthcare, which is at the end of the day, what this bill does is it prioritizes tax cuts for wealthy people and large corporations paid for by cuts to programs and services for people. That means that people who are trying to maintain a foothold in our economy, who are trying to get back to a place where they can return to work or have experienced job loss and need some basic economic security floor beneath them in order to be ready to re-enter the workforce, or they're people who have disabilities or are older Mainers, are at risk of being hurt simply because of hoops, hurdles, red tape that's being created, and by decisions at the federal level to undercut these programs at every turn. So as we think about supplemental nutrition assistance, that's happening in a couple different ways. Costs are being shifted to the states for the first time in this program's history. We are projecting to see about $70 million more per year that the state is on the hook for if we want to continue to preserve these programs for the people who currently benefit. But the other thing we see with the provisions of this bill is not only is there a sense of who wins and who loses, not only is there a sense of shifting the burden onto either individuals or onto states to maintain those programs, which creates pressure on other programs and potentially crowds out funding for those programs, but it also creates pressure on the economy more broadly. So when we talk about healthcare, we're looking at healthcare jobs, healthcare workers at risk. When we talk about nutrition assistance, one of the things we know is that those dollars go immediately into our local economy, into our local grocers, who are the recipients of the dollars that people are using to buy the food to put on their table for their families. So there's a whole continuum of impact that is really important to bear in mind as you think about how this stuff unfolds in Maine. And a disproportionate share of that impact is going to be felt in rural places. So Alex, can you, just like you did with Medicaid, take a few minutes and sort of dig in on how the SNAP, the Supplemental Nutrition Assistance Program, what some of the changes are there and what that means for Maine and Maine people?
Yeah, thanks, Garrett. Again, sorry to be the bearer of so much bad news, but I think it's important for us to all understand some of this is actually happening right now or has just gone into effect. Um, and as you noted, this is just piling on to an already, dire situation for many of the folks that we're working with. One of the changes that you will remember from Medicaid are expanded work reporting requirements. Unfortunately, those have already gone into effect for SNAP in Maine. Um, there were already work reporting requirements for some people using the SNAP program, and those have been further expanded up to the age of 65. So in the first month that someone turned 65. And I did notice there were a few questions about impacts to older adults. So you'll see that the bounds for the work reporting requirements have continued to be pushed up and are now up to 65, and also include caregivers without children over the age of 14 in their households. So sometimes these are people providing care for older adults, for children, and now being expected to report work, volunteer, and or training hours just to keep a pretty meager food assistance benefit. So SNAP has a time limit, so you're only eligible to receive SNAP for 3 months in a 3-year period if you don't comply. So it's very strict and can be the difference between a family being able to eat or not. We also know that SNAP and Medicaid are work supports. That's been shown through good research and also through our own experience. It is very difficult for people to find and stay employed when they don't have the food and the healthcare that they need to be healthy, whole people. Another theme you will recognize from the Medicaid cuts are additional restrictions for immigrants. Those have not gone into effect yet, but they're expected by November 1st of this fall. It is the same group of people that are being targeted, lawfully present immigrants with humanitarian protections, which feels particularly cruel. So that includes refugees, asylees, people escaping persecution, and domestic violence and trafficking in some cases are no longer going to be eligible for federal SNAP. We're still awaiting guidance in the state to understand how that will be fully implemented, but you'll see like doorways, particularly for immigrants who are already being persecuted by the federal government to meet their basic needs, are just closing and closing. And already people who are undocumented or with uncertain statuses have never been eligible for these benefits. So these are also people who are longstanding community members in some cases, or who have gone through a long, expensive, and arduous process to arrive in our country. And then another cost shift to individuals is the devaluing of these benefits over time. This bill froze the baseline for SNAP, which means that they can't reevaluate the methodology based on new science or new information. And over time, we'll see a devaluation of the current benefit levels. As we know, grocery prices are on the rise for everybody. There's also a severing of the what we call heat and eat connection, which is really, really important in Maine, that for most households, if you received the minimum benefit of a LIHEAP, you were automatically eligible for the maximum benefit for your household in SNAP. And now again, people are going to have to jump through more hoops in order to report their heating costs to the department and make sure that they are getting the maximum benefit. And all of this is by design to encourage people to drop out of the program. So just want to be clear, this is not about, streamlining administrative processes. This is about gumming up the works, creating more red tape, making it harder for people to get and keep these benefits. And unfortunately, it might work. So it's up to all of us to spread the word, particularly around the work reporting requirements of how people can comply and make sure they keep the benefits that they need.
Great. Thanks, Alex. I think what we will do now is transition from talking about some of these programs and specific cuts that are going to trickle through Maine and Maine's economy to talking about some of the more direct impacts on workers and on the workforce. And in particular, sort of around our clean energy economy, which is honestly the a future for us in terms of economic security. What we know in the case of Maine is we export a lot of resources out of state to support our heating needs, our energy needs, etc. And we were on a pathway to having greater energy security, to having more jobs in our economy, and the brakes have really been pulled on that. So here to talk to us about that is Francis. Francis, what can you tell us about this bill and its impacts? And again, apologies for folks if this all feels a little like gloom and doom, but again, really important to understand and connect the dots so that you can share this information with friends and family and others in your community, and ultimately so that we can begin to think about how we move a path forward that gets us back on track with some of these things. So Francis, give us the round the world view on this stuff.
That's great. It's great to be with you. Thank you, Garrett. Good to be with all of you. I'm happy to, in the Q&A, touch on some of what Maine has already done in just the last few months to actually, I think, address and arrest some of these really horrible gloom and doom things. So I think like this is not just a one-directional thing, but it is challenging, and we shouldn't mince words here. Before I talk about One Big Beautiful Bill, let me just back up to 2022 to give context of what we have lost in the last few months. So in 2022, many of you may know the Biden administration and Congress passed what was then called the Inflation Reduction Act, which still is in many ways the most meaningful piece of climate, clean energy, and good jobs policy that we've had maybe in this country's history. But I think a really key piece that I think puts this all in context is that bill for the first time married really significant tax credits in the form of, up to 30, 40, or 50% of the cost of an entire clean energy project, solar, wind, battery storage, hydro, whatever, to good job quality labor standards. And what I mean by that is like requiring developers and contractors to pay prevailing wages, which is like a higher than minimum wage that is really, really, really critical tool in the construction industry, which is notorious for cutting corners and driving down wages for workers, and also required those employers to utilize apprenticeship programs, which are proven workforce development models to really train the next generation of clean energy workers. Put it in a macro perspective, I mean, the clean energy economy is growing faster in workforce than faster than any other sector of our economy, like two times faster than the state of Maine's overall workforce growth. So this is a significant growth area. It means a lot for our workforce, and certainly, our organization is a coalition of labor unions, many of which work in the building and construction trades and build the clean energy that some of you, as you drive around the state of Maine, have seen. And so, what the One Big Beautiful Bill did is essentially claw back in a very significant way the vast majority of those tax credits that the Inflation Reduction Act had put out there. And the IRA had transformed in many ways and juiced, the momentum that already was taking place in the clean energy economy, put it on steroids, and had really, allowed some of our building and construction trades unions to double the size of the membership that they have out building these projects. To put it in perspective, two of the IBEW, the electrical union locals that operate in the state of Maine, 10 years ago were bringing in 3 or 4 or 5 apprentices to their annual apprenticeship cohort. As recently as 2 years ago, one of the locals was bringing in 60 to 70. So we've seen just tremendous growth driven by clean energy. IRA was a key driver of that. There were 145 projects that were slated to get built in the state of Maine, 9,000 jobs, $8.8 billion of total investment. Again, really strong transformative labor standards tied to that investment for the first time. And the One Big Beautiful Bill in essentially one stroke curtailed much of that and said, basically by the end of this year, if a project has not broken ground, they cannot qualify for those tax credits. There's a few exceptions to it. I won't get into those. Happy to talk about that in the Q&A. But, this has meant real impacts on real people and not just workers. But I'll touch on both workers and then working class people and all of us who pay an electricity bill and what the impacts have been. Briefly, we've seen so many projects that were slated to break ground this year pulled back, either put on ice, canceled it, or put on hold indefinitely. We've seen, 50% unemployment in some of our union locals just this year in the last few months as a result of developers pulling back, just alone on the uncertainty, let alone what the future looks like. This is real. This is cascading down to how many workers they're bringing into next year's apprenticeship program, which is going to have, ripple effects for decades to come as the workforce starts to shrink. People are going out of state to go find work in other parts of the construction industry because they can't stay here in Maine and find stable work. That disrupts them, their family life. Folks are leaving the trade altogether because they're saying, I can't find stable work in this industry. I thought I had a pipeline here, but now I'm leaving. That is bad for all of us in a moment when we badly need to be doubling, tripling, quadrupling the size of our clean energy workforce to build the clean energy economy we desperately need. On the ratepayer side, I mean, anyone who pays an electric bill is now already seeing, just last week, CMP proposed another rate increase. That's driven in part by the need to upgrade our grid, but the cost of electricity to generate that power is going up as a result of these tax credits going away. The recent study that we just saw from national partners for Maine specifically said we're likely to see 17% increase in the cost of producing electrons that we need to keep the lights on, right? This is a big hit for folks who are already struggling and feeling the squeeze, as Alex just said, on healthcare, on food, on everything else, on housing. And so this is it's another squeeze at a moment when we can't afford to see another one. Another pressure point is with AI data centers getting built everywhere, power demand for the first time in 20 years is going up. And so this is having this double squeeze effect where we're constraining new clean energy, which is the cheapest form of energy we can bring online quickly, at the same time that demand is going up. And so this is just having a real knock-on effect on the day-to-day cost of living, cost of energy that folks in our state are feeling. The last thing I'll say is, look, Maine is only 9% of the regional New England electricity market. We're a small state by population, but we have the largest landmass. We are likely to be, and everyone I think understands that in New England, we are the place that you're going to build electricity and export that energy to the regional grid. We are really the site, exhibit A of where jobs, clean energy investment, and workforce can grow, and where we can really benefit all Maine ratepayers by bringing on new, cheap, reliable forms of electricity. This economic uncertainty, these curtailment of tax credits is devastating to really building out that regional reliability and new clean energy capacity that we badly need. It's not just a state problem. This is definitely a regional challenge that, we are doing our best with state policy to try and stem the gaps, but it is challenging, and it is not great for creating the business and worker environment that we need and to really grow at a moment when climate is not stopping. Climate change is not stopping. We need to take this seriously, and this is going in the wrong direction.
Thanks, Francis. I mean, I'm kind of breathless on that one. You really covered a lot of ground there and just made it crystal clear how this really hurts our economy. It hurts our workers. It hurts our future prospects. So I think one of the things we've looked at the Maine Center for Economic Policy is sort of broader economic impacts to tell that story, again, helping people connect the dots. I think what a lot of people don't necessarily appreciate about Maine and our economy, and it sounds like in the clean energy sector, it's even more than this, but at least in the economy more broadly, 1 out of every $5 that cycles through Maine's economy comes from federal sources. And so when you talk about cutting those resources back, there are significant economic consequences that comes with that. So in the case of the Supplemental Nutrition Assistance Program and healthcare cuts, we're talking about over $300 million a year that's going to be taken out of Maine's economy. That will reduce economic activity. It imperils our healthcare infrastructure and jobs in that place. It also has a trickle down effect in terms of other jobs throughout the economy. So our calculation is that potentially puts about 3,500 jobs at risk in the state. That's before, again, accounting for the impacts of the cuts to clean energy that Francis just alluded to. So as I said earlier, when the sugar high of the tax cuts goes away, we are going to be left with a weaker economy and greater inequality than we had before. These impacts will be felt disproportionately in rural places and among people who are already struggling to maintain their economic footing. So we just want to leave you with that. So we're about to get into your questions, but before we do, Francis and Alex and I aren't going to just besiege you with gloom and doom. We're going to try to give you a little bit of a sense of maybe what are some things we could do here in Maine to lessen the sting of these proposals. And happily, we're probably in a better position than a lot of states because of the way we've managed our resources, because of the way we've approached these kinds of problems in the past. But that said, we have significant challenges that are ahead. So Francis, is there anything you would lift up in terms of what you think about going forward in terms of possible either solutions or ways to sort of reframe how we're approaching these issues to sort of put ourselves in a better position in the future.
Yeah, I'll leave you with two things. One, the legislature, and we work closely with partners in the legislature to do this, passed in June two really important bills that I think, were in the works long before this one big beautiful bill passed, but I think it timing wise couldn't be better. Both those bills together do really important things. One, they set a more ambitious clean energy target to say that the state of Maine is going to require all utilities who produce electricity in our state to produce 100% clean electricity by 2040. That's 10 years sooner than our previous target. That's going to really drive an important clean energy market for developers, for workers, for contractors in a way that, backstops some of what the federal government has walked away from. Number two, we've created a new Department of Energy Resources that is about to come online either this month or next month and has a procurement structure put in place to really be the engine of how we're going to actually work with the full spectrum of contractors, developers, and workforce development partners in unions to actually get to that 2040 target. And a key piece of that legislation and that new department is that it's really trying to take a more regional look and how do we collaborate with other New England states to combine our purchasing power, to combine our planning power. We operate, as I said, on a regional grid, right? We are 6 New England states connected to the grid. It's not just the state of Maine. Why can't we bring, and this bill says we will now bring planning, financing, and other coordination powers of the state with other New England states to really try and pick up and drive forward in a more ambitious way what the federal government had tried to do with the Inflation Reduction Act and what they've walked away from now with the One Big Beautiful Bill. So I feel optimistic that despite these really challenging economic headwinds, that ultimately our region is stepping up, the state of Maine is stepping up, and there's going to be some real hurdles over the next 6 months and 12 months as market corrections happen. But I feel confident that we can actually make progress over these next 3.5 years, despite some very challenging, they're laser focused on taking out offshore wind projects or canceling transmission projects that we need to bring energy online. But there are some really important infrastructure and state capacity pieces that are getting put into place in Maine and across New England that are really critical to keep an eye on and give me hope.
That's great. Thanks, Francis. Alex, going to turn to you on this question. So from your perspective in the areas that you work in, what can we do to lessen the sting here in Maine, or what's being done already?
Yeah, thank you. I won't pretend that I think the state can fill every single gap left by this federal funding, but I think one thing we do know is we can ask the very wealthy and corporations in our state to pay their fair share so that we can generate more revenue to put into these really, really essential priorities and our shared values as a state. I also think if we're talking about, this has deepened inequity, I really think we need to use an equity lens when we think about what we are going to focus on and who we are going to try to support. And I would argue that we need to think about the people at the lowest income spectrum who are getting hit the hardest by this bill in all the ways that you talked about. And I think that extends beyond just maybe these immediate programs and thinking about some of our other safety nets like general assistance. We had an eviction prevention program. We know housing is kind of the first thing that people start to struggle with when other parts of their budget gets constrained. I do think that we need to prioritize programs that are helping immigrants, weather this storm that they're experiencing right now and all of the cumulative targeting of immigrants in all the ways by this administration. And again, leaving some of those doors open that I talked about that are closing at the federal level. And we do have some existing infrastructure already in Maine to support people. And so I hope we will think about equity as we enter into the difficult decisions.
Yeah, I think that's a really important point, Alex, that there are people who are already sort of being left behind or struggling, who are completely cut out as a result of some of these policies and programs. And if we're looking out for our neighbors, we're looking out for our communities, we really need to understand that and have a laser focus on that. Your comments also get to a little bit this question we got from Emma Cipriani about to what extent will Maine as a state realistically be able to shoulder some of these economic costs and prevent potential harm to Maine residents. I think it's a great question, Emma, and I think, again, as Alex alluded to, one of the solutions we know is that if you look at the tax cuts that were enacted during the LePage years, that's reduced the amount of revenue we have at the state level by $1 billion. That is more than what we're talking about having lost in the federal funds through this bill. So I'm not suggesting that necessarily we're going to raise taxes to, compensate for the hole that's being created. But I do think, as Alex alluded to, there is certainly additional capacity and opportunity to do so. And we're well positioned that way. At the same time, I think there may be some provisions to change our ability to tap into the rainy day funds, to possibly use some of the Medicaid support funds that are already in place to ensure that we, again, have continuity of care, continuity of coverage for people. Because what we know is when we lose that, if a rural health facility shuts down in Aroostook County, that's not coming back online very easily. And, if healthcare workers are leaving their place of work because they're no longer getting paid at a level that allows them to provide for their families, it's really hard to get them back into those positions. And so I think at this stage, we definitely need to prioritize how we sort of prevent harm. And I think one way we do that is we recognize that there is capacity to at least plug some of the biggest holes that are going to be created. And at the same time, as Alex said, to be aware of specific populations of people who are being left behind. We have a couple more questions that we want to get to, and then we'll wrap up here in just a second. But Victoria Morales asked a question that, does the bill restrict commercial insurance from insuring refugees, asylees, and other residents? My understanding is, and I'm no expert on this stuff, but yes, that, or Alex, go ahead. I think you may have a more informed opinion on this one, or
I didn't mean to cut you off, Garrett. I was just going to add after you that I think if you're referring to the marketplace and private, I think people are still able to get insurance through their employers. But if you're talking about marketplace subsidies and the eligibility for those subsidies, yes, those are also being targeted. So that same group of people that I mentioned, so a large group of lawfully present immigrants who were previously considered qualified for many public benefits and for things like premium tax credits on the marketplace will no longer be eligible for those in coming years. You might say, well, they could still purchase the health insurance, but again, as we know, those insurance rates are going up. And if you cannot access any subsidy, that essentially cuts off your access to being able to purchase that plan and that coverage for your family.
And, Alex, I think the other piece that you're alluding to here is health insurance rates were going up in Maine even before this happened or came online. Now, part of the reason, arguably, why they may have gone up is because of the anticipated additional cost that's going to occur as fewer people are being covered through Medicaid. Those costs, people still get sick, people still need health care, and someone has to pay for it somewhere within the system. And in this case, some of those costs may be shifted onto other people who have health insurance. So what we're seeing is the potential for a spiral in which fewer people are on, costs go up, more people drop their coverage, costs go up even more. This is a potentially very scary scenario here in Maine. I think the other question that came up is one from Marianne Pinkham about how this bill impacts older Mainers. Alex, I don't know if you want to speak to that, or Francis, certainly happy for you to jump in from your perspective as well. But Alex, what do you got on this one?
Sure, I can focus on healthcare and food since that's my area, and I'll leave Francis to the utilities piece. But we know that the highest utilizers of Maine care are also older adults, right? And also we see that a lot of these work reporting requirements and just additional barriers are also targeting a higher and higher age, demographic. Medicaid, also little known fact, huge payer for long-term care and nursing care in this country. And so when you have a gutting of Medicaid, essentially, that puts our long-term care facilities and nursing facilities in this state at great risk, particularly, as Garrett mentioned, in more rural and low-income areas where a greater proportion of people are utilizing Medicaid. as their payer for that long-term care. So I think that we should worry about that. That's very concerning, and it's something to also keep in mind when we're thinking about the implications of the healthcare system. I think people are focusing rightfully on hospitals, but that extends out, right, to those long-term care facilities. I think also community care for people with disabilities is another thing that people have raised as a great concern. Will those community sites still exist in certain places? We don't know the answer to that, but certainly there will be an impact.
Yeah, Francis, anything else you want to add on that particular
Briefly, I
question?
mean, like after housing for retirees, like especially those on Medicare, I mean, energy costs is usually the second or third largest portion of their fixed income budget. And so, yeah, if we're going to see energy costs go up 17% because of the rollback of these tax credits, that's directly eating into a significant portion of their already constrained budget. So, yeah, it's not good. This is another squeeze for folks who can't already take it. And so I am concerned. And again, it also sends a message to the broader like grid and utility reform that we need to make really important investments in reliability that again when the power is out in the winter, like it is folks who are like have mobility constraints because of their age that get hit the hardest by not having reliable power, which is downstream of again those really important grid reliability upgrades that we need to make, which the rollback of this bill makes harder.
Yeah. So I think we're going to move to wrap here. But before we do, Francis, Alex, I want to give you all a chance to have maybe one last word, if you will. Alex, I'll throw it back to you. Anything you want to leave folks with in terms of this topic or, suggestions on how they might get involved or other resources they might access? What you got?
Well, in addition to the sort of policy pieces that I mentioned, I think we all have a role in helping to share this information with people, right? It's a lot. There's no way we can talk about it all in this one space. And particularly for people with low income that are being hit with multiple parts of this bill, I think we all have a role in helping to demystify it and supporting people to meet their basic needs. So let's commit to that. I also think we need to, again, just underscoring the prioritization of equity. If we're having this great transfer of wealth and an increase in inequity, you know, let's double down on those values here in Maine and make sure we're considering people with the lowest income and who are most marginalized already by these changes. And yes, you're welcome to reach out to me directly with questions or concerns, and I think we'll be all working together on some of these solutions.
Great. Thanks, Alex. Francis, any final benedictions from you?
Yeah, two things. One, I think like we did a lot of storytelling of workers' stories around the One Big Beautiful Bill just to help like we went to apprenticeship classes to just like help folks connect the dots between faraway federal policy and like their jobs and their electricity rates. We want to do a whole lot more of that. I put in the chat that which, you know, folks can share like some of the compilation of those stories that we have on our website. You're welcome to check that out. The other thing I'll say is like we now are doing some really fun and interesting organizing in mobile home parks, which have some of the highest energy burdens, also where there's a lot of older folks who are getting hit on all the things that Alex said, plus energy costs, plus like their mobile home parks are being bought up by like awful private equity groups from out of state and they're doubling their rent. I mean, it is like some of the most exploitative, like multiple, you know, hit on multiple fronts. And we're bringing like folks together to like talk about like overall cost of living issues, organized together to push back against their landlords. And then like, I mean, the whole vision here is to like also help folks from across the political spectrum come together and like, let's talk about these issues and like who's squeezing you and like why and not some of the divisive cultural issues that the right is like very successfully using to set the agenda. And so, you know, we're doing this in a bunch of parks across the state over the coming year and a half. Like we're also training up people to do this in their community. So it's not just us. And like we'd be really excited to like talk with any of you who are interested in thinking about how we can like reach rural like working class voters on whether it's housing, healthcare, energy, like issues and bring them together and actually like set a different agenda for 2026. And like, yes, talk about One Big Beautiful Bill and whose fault it is that these squeezes are what they are, but also like, what is our constructive vision for the future, and how do we, again, reset the narrative from some of the awful things that we've seen out there that will be on the ballot next fall to, like, you know, what we would like to see in the world around tax fairness, around a more just housing and energy policy, around on and on. So we're excited to do this. We're happy to partner with any of you who want to do this in your community.
Great. Thank you, Francis. And yeah, do check out the videos if you haven't, that Francis is alluding to. It's really some very compelling stories from people who have lived experience on these impacts of these changes. And I think that also we've been working on that at MECEP. Through Maine for Tax Fairness, we've been talking to people around the state about sort of this bill and what it means. And what we're finding is it's hugely unpopular across the political spectrum. But I think, as Francis alluded to, at the end of the day, we need to ultimately be about solutions. And certainly that's what we're working on. But if I could leave folks with one thought, it is the idea that these policies get enacted in some faraway place. And sometimes it's hard to connect the dots and appreciate that the changes we're seeing in our communities are a direct result, actually, of these actions taken or not taken in Washington. And sometimes the impacts don't ripple through for another year, 2 years, 3 years. So the more we can do to help people understand, to help appreciate that their loss of health insurance is about prioritizing tax cuts to billionaires and large corporations. That's what it is. The loss of investments in our clean energy infrastructure and those jobs going away is totally about prioritizing those cuts for the wealthy. And so, you know, together, I think we can find a better path and speak to our better angels. So want to thank folks for joining us today. Certainly, again, we've got the contact info in the chat if you're curious to reach out to either Francis or Alex or myself. Also info@mecep.org for any general inquiries. As you may know, this event has been recorded and we'll be sharing it out. So please feel free to reply to the email if you have thoughts about how we can do a better job with these webinars. I know in this case, we jammed a lot of content, multiple hundreds of pages of federal legislation into one presentation, but hopefully you came away with some good information that maybe you didn't know beforehand. And I just want to, again, give a shout out. We have an upcoming report about how Maine's future prosperity is also tied to justice for the Wabanaki nations in the form of land return and sovereignty reforms. So keep an eye out for that. But again, thank you for joining us today. And thank you, Francis. Thank you, Alex, for joining us as well, and for sharing your knowledge and wisdom and being partners in the fight for justice more broadly and a strong economy for all Maine people. So with that, we'll see you all again sometime soon. Thank you.